I think that for most speech-language pathologists, we have a good understanding of sound development once a child starts using words. But what about children that are not yet vocalizing? We see this in young children, but also in children who have a hearing impairment that has been treated and we are helping to start to speak. We also see this in children with cochlear implants who have just gotten mapped. We see it in children with apraxia of speech who have motor constraints, so their development is not following the normal trajectory in the development of their speech sounds. We see it in children with apraxia of speech who have motor constraints, so their speech sound development is not following the normal trajectory. And we also see it in nonverbal kids who are just beginning to speak. What we need in order to be successful in all of these situations is to understand what the normal trajectory of sound acquisition looks like before linguistic sounds, aka the beginning of sounds with meaning. That way, we can identify where a child is and write goals about the next stage they should be entering. Here's what it looks like. We begin with the phonation stage that is basically a few vowels, consonants, throaty sounds, and phonation with a closed mouth. We then move on to what's called the GOO stage, which begins to incorporate velar consonants. Stage 3 is the expansion stage, which includes strong vowels, bilabial trills, squeals, and growls. Then, the canonical stage starts to look a lot more like language as pattern consonant-vowel combinations are introduced. And lastly, variegated babble allows a child to play with all the sounds that eventually will form words. We talk about all of this in detail in our course Prelinguistic Vocalization Patterns Across Languages, as well as what sounds look like across the first year and how prelinguistic vocalizations differ based on different languages. This is a handy paper-based course which you can read through and print off to share with colleagues and parents. If you work with young children or nonverbal populations and need ASHA CEUs, it's a great use of your time.